Hi, I'm Anna.
And I'm Christina, and we're surgical techs at Dermatology Partners.
We are following up in regard to your recent surgery. If you are viewing this 24 hours after your surgery, then it's time to change your dressing. To change your dressing, gently clean the area with warm water and soap that is free of dyes and scents, such as a Dove soap bar.
Once your wound area has been cleaned, it's free from blood and no longer has a dressing, use a Q-tip to place Vaseline directly on the wound at the suture line. If the blood has dried over the wound site, take a piece of gauze, soak it in hydrogen peroxide, then place the gauze on the wound site, holding it until the blood is softened. You will need to continue this same routine every day until you come back for your suture removal.
If you are experiencing drainage, redness, or light bleeding, please refer to the wound care instructions that were given to you. If you're experiencing bleeding that is soaking through your bandage or running outside of your dressing, hold direct pressure for 20 minutes on and 20 minutes off of the site. Continue this rotation for about an hour. If it does not stop bleeding, contact the phone number that's referenced on the wound care instructions.
If you have any general questions, please contact our office at 717-431-7546. Thank you for trusting us with your dermatological care.